Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we'll be in chapter number 9. The book is called The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. We will begin on page 141. So to begin, on page number 141, at the introduction, it says, the purpose of this chapter is to provide the rehabilitation nurse with the structure necessary to develop and implement a family-centered plan of care so that a person with a disability or chronic disease can successfully maintain and manage his or her therapeutic regimen safely and effectively in the community. So we see health promotion and maintenance in chapter number 9. So the World Health Organization, better known as the WHO, on their website shared that health promotion is the process of enabling people to increase control over and to improve their health. So a part of health promotion will include good governance. And according to the World Health Organization, it says to strengthen governance and policies to make healthy choices accessible and affordable to all, and create sustainable systems that make whole of society collaboration real. There's also another component of health literacy. Health literacy means improving health literacy in population provides the foundations on which citizens are enabled to play an active role in improving their own health, engage successfully with community action for health, and push governments to meet their responsibilities in addressing health and health equity. So we have seen governance or the government taking an active role in helping patients who are disabled or who have chronic illnesses. On page 142, the landmark Americans with Disabilities Act, better known as the ADA of 1990, protects the 54 million Americans with physical or mental impairments that substantially limit daily activities. These activities, of course, include working, walking, talking, and seeing, hearing, or caring for oneself. It goes on to say its 5 titles oversee legislation in the areas of employment. Remember, Title 1 has to do with employment. Title 2 has to do with public services. Title 3 has to do with public accommodations. Title 4 has to always do with telecommunication. Title 5 could be miscellaneous provisions for public accommodation and services operated by private entities. So the writer on page 142 is stressing that the ADA has allowed many people with disabilities to live in the community. It says by using health promotion strategies, people with chronic illness and disability can prevent long-term sequelae that would otherwise threaten health. Maintenance of optimal health includes both the prevention of further loss of function and the prevention of secondary conditions such as orthopedic, cardiovascular, cardiopulmonary, and psychosocial disorders. So remember, under health promotion, you will have health education, health screening, and disease prevention. We are now at a great place to talk about social determinants of health, better known as SDOH. These are the non-medical factors that influence health outcomes, conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The SDOH also includes social supports, education, occupation, income, access to healthcare, race or ethnicity, nutrition, activity level, illness, injury, and genetics. So what does it actually look like? It could look like a partner level attorney with $1 million in the bank that attended Yale University. He is going to go to Turkey in his private jet to access a world famous gastroenterologist versus a fast food worker making $15,000 a year with no savings, that has a seventh grade education. He's waiting in an overcrowded community hospital in the emergency department for treatment for the same type of illness. So that means that health is influenced by social determinants, and the cultural norms of a client's community will influence an individual's behavior. I also want to share that the obstacles and influences are different in every community. Rehabilitation nurses must understand the unique determinants of each community in order to develop strategies and interventions and to promote the best outcome for the population of clients served. Nurses also have to be able to identify key health issues and needs of the community. The 2010 Affordable Care Act requires all 501c3 hospitals to conduct a community health needs assessment and subsequent implementation plan every 3 years. This requirement is a valuable opportunity for healthcare providers to collect data about the community, including the demographics, socioeconomic factors, and health service utilization trends. It's also an opportunity for community groups to plan and work together rather than working in independent silos. I think it's also very important working with various communities to be mindful of implicit bias. So, what is implicit bias? Implicit bias refers to the beliefs and attitudes that affect our understanding, actions, and decisions in an unconscious way. So if I don't like, I don't know, Korean people, I will not treat a Korean pregnant woman who comes in active labor nicely. So I have to be mindful of my own feelings about this particular race of people. And I also need to be mindful of or be self aware of my surroundings so that I am always thinking, do I have implicit bias against a specific group? So let's remember that rehabilitation nurses, as an advocate, will encourage and teach family members about equipment, procedures, medication, and ways to manage emergencies. Rehab nurses also will make referrals to rehabilitation counselors, peer counselors, and those providing psychological services. They will also contact state disability offices, work with commissions or departments for assistance. They will promote and provide education to healthcare providers and caregivers within facilities and the community, and consult one-on-one with providers regarding healthcare issues, ways to manage clients' healthcare needs, and ways to promote access to healthcare services. And every time I think about healthcare services and access, it's so important to discuss literacy. So, what is health literacy? That is the degree to which an individual has the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Page 149 is dedicated to home safety and prevention of falls. We know that falls sustained by adults are a substantial health concern for many community dwelling adults, particularly seniors. It is estimated that at least one-third of all falls sustained by seniors involve environmental hazards in the home. The most common hazard for falls is tripping over objects on the floor. Other factors include poor lighting, loose rugs, a lack of grab bars, or poorly located or mounted grab bars, and unstable furniture. So the World Health Organization in 2018 indicates that fall prevention strategies should be comprehensive, and for older people should include screening for risk of falls in the client's living environment and a home evaluation for those with known risk factors or a history of falling, which just makes sense. They're going to be a lot of times confined to their home environment. Let's do a proper assessment of the home to identify any tripping hazards or to ensure that bars are properly mounted for safety. Lastly, it's imperative as we complete our nursing assessment of altered health maintenance to look at all of the different types of diagnoses that may be applicable to those individuals we treat. So we need to look at an individual's perception of health. Do they have the ability for self-management abilities and knowledge? What is their current stage of grief related to the injury or disease? What are their religious practices? The only way we're going to find that out is to talk with the patient or a caregiver. It says the rehabilitation nurse's most important goal in community-based rehabilitation is to help the client and family achieve the best possible outcomes. It says motivational interviewing is a useful tool to teach and encourage behavioral change. Because most of the time, there's some factor, whether it be smoking or tobacco cessation, something that the individual need to do to put them on that road to wellness. So it's important that we conduct a motivational interview. And on page 148, it gives certain tips on how to do it. So it talks about asking permission, number one. Number two, elicit a change talk. 3, explore importance and confidence. 4, ask open-ended questions. 5, use reflective listening. 6, use normalizing statements. 7, use decisional balancing. 8, use the Columbo approach. And everyone knows I love Columbo from the TV show. 9, make statements supporting self-efficacy. 10, use the readiness to change ruler. And lastly, use affirmations. This week, we reviewed health promotion and maintenance in chapter number 9. We also talked about implicit bias, social determinants of health, and lastly, motivational interviewing. I want to thank you for coming along with me on this journey, asking that you will like, comment, and subscribe. Wishing you all the best. Be well. Bye-bye.